ERDF is monitoring one of the many projects at Biogem to learn more about innovative nanosensors for the diagnosis and prognosis of laryngeal tumors. They went directly to this biotechnology company specializing in molecular biology and genetics to meet Professor Michele Caraglia, a full-time teacher of biochemistry at the medical faculty of the Vanvitelli University. Where does the idea of creating the smart kit for the early diagnosis of laryngeal tumors originate?
In our blood, we have vesicles that are shuttles that transport some molecules that are secreted by our cells. And the cancer cells secrete some exosomes, some shuttles that are different from the shuttles that are secreted from normal cells. And so our idea was to characterize the shield of these shuttles. And so we have characterized the surface of these molecules, and we have found that they are very different from those that are secreted from normal cells. And so with the specific antibodies, we can distinguish the shuttles from cancer cells from normal cells. And so with a simple blood collection, so we can do the diagnosis of laryngeal cancer.
Okay, thank you.
What are the main progress made in the development of the diagnostic kit, and what have been the results of the tests conducted so far?
We have designed a nanosensor, and this sensor that is based on nanotechnology is able to do the diagnosis directly from a blood droplet. We can deposit this blood droplet on this device, on this little strip that we have designed. And when you develop a reaction, you see that you have these exosomes, these shuttles that are specific for laryngeal cancer.
Where the funds obtained from the European Regional Development Fund specifically allocated, can you provide a breakdown of expenditure items?
You have to consider that we have received a financial support of about 600,000 euros, and about half was spent for personnel and the other for consumption materials.
What are the next planned steps for the project, and how you do intend to ensure its practical application and dissemination?
Once we have developed the first prototype, we have to perform an industrial development of this prototype, and we have to deposit the patent. That is the next step. Once deposited the patent, we have to develop the nanosensor with the testing of the nanosensor on a very large population. So we need about 1,000 people in order to determine the efficacy, the sensitivity and the specificity of the kit. Then we have to ask the approval from the regulatory agencies, the Italian agency and the European agency, and then we can, once received the approval, we can commercialize the kit.